Hi, I'm Dr. John Stanton. I want to talk a little bit about knee arthroscopy. Now, we do arthroscopy of other joints in the body, such as the shoulder, the ankle, occasionally the hip, but the knee seems to be the main area that we do arthroscopy on. I want to talk just a little bit about the anatomy of the knee. This drawing here in the middle shows what the knee would look like from the end. This is the thigh bone, the anterior cruciate ligament, the meniscus on both sides, the top of the shin bone, and this is the kneecap up here on the top. Now, what I've shown here on this side picture is that the end of the thigh bone has a layer of cartilage. The top of the shin bone also has a layer of cartilage, and the meniscus is sitting in between these. So if you look at the top of the shin bone, the meniscus is sitting on both sides and is triangular in cross section. Occasionally, a patient will get a tear or some kind of degeneration of their meniscus. So one of the things we can do with arthroscopy is to look inside the knee and clean up these areas of the meniscus that are torn in the back. Additionally, we can reconstruct a torn anterior cruciate ligament. I want to mention one or two things about knee cartilage. This represents the bone on the back of the kneecap here, and this represents the cartilage. Microscopically, the cartilage is arranged in fibers, like an indoor-outdoor carpet, but occasionally it'll become torn or missing, or there'll be a loose flap of cartilage. What can we accomplish with a knee scope? Well, we can smooth down the rough areas of cartilage and remove these loose flaps, okay? But it's important to remember that we cannot make the knee completely normal when we do a knee arthroscopy. I want to just kind of show you just a little bit what the instruments look like. This is a model of a knee. This would be the right leg. And here we have the end of the thigh bone, the meniscus, and the top of the shin bone. A scope, and this is similar to what a scope looks like, is a relatively small instrument that can be inserted through one or two openings on the knee to look around inside. We also have a device like this, which is a shaver, which is able to go back into the back of the knee or on these surfaces to smooth down the rough cartilage or remove the torn meniscus. The knee arthroscopy is done through 2 and occasionally 3 small openings the size of a buttonhole. The surgery takes about 25 to 35 minutes. The patient will be on crutches for 2 to 3 days afterwards. The bandage can be taken off on the second day after surgery and the patient can take a shower. And then the patient returns a week later to have those 2 stitches removed. There may be swelling in the joint after surgery if we remove a lot of inflamed tissue. Usually by a couple weeks after the surgery, the patient feels either the same or better than they did before surgery, but has the advantage of knowing what's going on inside the knee, as well as knowing that we were able to take care of some of the problems, if not make the knee completely normal. Please check out our website and see what other things we have to offer here at the Bone and Joint Group. Thank you.